Today, we're going to talk about stress, tension, and nervous system health in older adults and how these factors can affect your overall well-being. We're not making medical claims or replacing your doctor's advice. We're exploring simple relaxation techniques that may help you feel calmer and more balanced. Because one of the biggest challenges for seniors is chronic tension that builds quietly over time, the kind that makes you feel on edge without knowing why. That tension deserves attention, and there are gentle ways to address it. What looks sudden from the outside is often the result of quiet changes building up inside the body over time. Changes so subtle that they're easy to ignore: tightening circulation, weakened signals, a nervous system that's been under stress for too long without rest. These things don't announce themselves loudly, they whisper, and when we don't know how to listen, we miss the chance to step in early. That's why this conversation matters. Chronic stress and tension affect millions of older adults. While we can't prevent medical conditions through relaxation alone, we can support our nervous system's ability to find balance. If you have stroke risk factors like high blood pressure, diabetes, or heart disease, continue working with your doctor on proven prevention strategies. What we're sharing today complements medical care, but never replaces it. So today, you're going to hear about 3 simple daily practices that support nervous system relaxation. These are not medical treatments. They don't prevent or cure any disease. They're gentle techniques drawn from relaxation traditions that some people find helpful for managing daily tension. And they're meant to work with your body to promote a sense of calm and ease. If you stay with us until the end, you'll understand why stroke risk often begins quietly, why the nervous system plays a bigger role than most people realize, and how small daily actions can help your body stay steadier and more resilient over time. Because too often these discussions happen after something has already gone wrong. What I've learned over the years is that the body rarely fails without warning. It usually gives us time. The problem is that the warnings are subtle and many people don't know what they're hearing. Long before a serious event, the body begins to change its behavior. Circulation becomes less flexible. The nervous system stays alert for too long. Signals that once flowed smoothly start to lose clarity. None of this feels dramatic. There's no sharp pain or collapse. Instead, people describe feeling slightly unsteady, more tense than usual, or just not themselves. And because those feelings don't seem serious, they're easy to dismiss. That's something many seniors can relate to. They've lived long lives. They've pushed through discomfort before. So when something feels mild or vague, they assume it's just part of aging or stress or a bad night's sleep. They tell themselves they'll deal with it later. I remember speaking with someone who once told me, "I thought I was just stressed." He didn't realize how much tension he was carrying until he began paying attention to it. He felt tightness in his shoulders, shallow breathing, and difficulty relaxing even during quiet moments. What stayed with me wasn't just his tension, but how normal it had become to him, how invisible the build-up was. That's why paying attention to your body matters. The nervous system responds to gentle care and consistent support. When we ignore chronic tension, it can affect our quality of life, our sleep, our mood, and our overall sense of well-being. The challenge is that tension often doesn't announce itself loudly. It accumulates quietly, and quiet signals are easy to ignore, especially if you're waiting for something more dramatic to happen. Many seniors tell me they waited because it didn't feel serious enough yet. That waiting is understandable. The body doesn't usually break all at once. It drifts, it hesitates, it slowly loses rhythm. Stroke risk often grows in that quiet space where signals soften instead of shout. This is where a lot of people misunderstand prevention. They think serious trouble will announce itself clearly: pain, sudden weakness, something unmistakable. But early risks doesn't always feel like that. It feels like tension that doesn't fully go away, a sense of unease, a body that seems to be working harder than it used to. That's because our sense of ease isn't just mental, it's physical. The nervous system influences how tense or relaxed we feel throughout the day. When we're chronically stressed, our body stays in a guarded state. This can affect sleep quality, digestion, mood, and energy levels, even when nothing appears medically wrong on standard tests. So yes, the problem can begin long before numbers like blood pressure rise, long before a doctor says something looks wrong on a chart. The nervous system plays a central role here. It acts like a conductor, setting the tempo for the heart, the vessels, and even breathing. When that conductor becomes strained, whether from age, stress, poor sleep, dehydration, or emotional load, the whole system starts to lose harmony. This is why so many seniors say they feel off but can't explain why. Their body is sending signals, but they don't have the language to describe them. And because nothing hurts, they wait. The body often compensates quietly rather than sounding an alarm. It tightens here, it adjusts there. Over time, those small adjustments add up. That's how early stroke risk is often missed. Not because people don't care, but because the signals are confusing. So how do we begin to notice these changes earlier? We stop listening only for symptoms and start paying attention to rhythm. The nervous system is constantly adjusting heart rate, vessel tone, and circulation based on what it believes the body needs. When that guidance becomes strained, flow can narrow quietly without pain. Many seniors later say they felt tense or unsettled for weeks beforehand. They sensed something shifting but didn't know what to do with that feeling. That tension often comes from the nervous system staying guarded too. Long, everyday stress, shallow breathing, poor sleep, and even mild dehydration can keep vessels slightly tight. Over time, circulation loses flexibility. When urgency becomes the body's default setting, blood pressure becomes reactive. That's why true prevention isn't about forcing the body to change. It's about restoring calm signals. Calm isn't a luxury, it's instruction. When the body senses safety, vessels soften naturally, flow steadies. The system works together instead of fighting itself. Once seniors understand this, they stop waiting for obvious warning signs. They begin supporting the nervous system directly, and the first step is simpler than most people expect. Before we continue, an important reminder: if you experience dizziness, sudden weakness, difficulty speaking, vision changes, severe headache or numbness, seek immediate medical attention. These could be signs of stroke or other serious conditions. The practices we're sharing are gentle relaxation techniques only. They are not medical treatments and do not prevent, diagnose, or treat any disease. Always consult your doctor about health concerns. We start with the tongue. The tongue is one of the body's most overlooked messengers. It sits close to important nerve pathways that influence heart rhythm, vessel tone, and the body's sense of internal safety. When the tongue is tense or poorly positioned, it can quietly signal alertness. When it rests correctly, it sends a message of calm before the mind even realizes anything has changed. The key here is placement, not pressure. Many people try too hard. This isn't about pushing or forcing. Imagine the roof of your mouth as a gentle ceiling with a small ridge just behind your top front teeth. You're not pressing the tongue forward into the teeth. You're simply resting the tip of the tongue lightly on that ridge. To do this, let your lips close softly and allow your jaw to relax, almost like you're about to fall asleep. The teeth don't need to touch. Then place just the tip of your tongue on that small ridge, not the whole tongue, just the tip. If you notice your jaw tightening, ease off. The sensation should feel light, not effortful. Once the tongue is resting, breathe in through your nose for a slow count of 3. Then breathe out slowly through softly parted lips, as if you were gently fogging a mirror without making a sound. Let the exhale be longer than the inhale. Repeat this cycle 3 times. Then relax the tongue and swallow normally. Most people finish this in about 10 to 15 seconds. If you ever feel dizzy, you stop and return to normal breathing. This should always feel safe. What's happening inside the body is subtle but powerful. The gentle tongue position combined with a longer exhale shifts the nervous system toward calm. It reduces sudden spikes in heart rate and vessel tightening. Over time, this helps lower strain that contributes to stroke risk. It doesn't replace medical care, but it helps move the body out of constant internal alert. One simple rule makes this easy to remember. If the tongue feels like it's pushing, it's wrong. If it feels like it's resting, it's right. The goal is a calm signal, not a strong one. Many seniors say they feel calmer for a moment, and then calm fades. That's not a failure. It means the nervous system is still looking for reassurance from the outside world. Calm needs reinforcement, not just intention. The nervous system evolved to read safety through touch, gentle pressure, and contact with the environment. When those signals are missing, especially for seniors who spend more time sitting or alone, the body stays slightly guarded even during quiet moments. That guard can slowly tighten circulation without anyone noticing. This brings us to the second practice, which comes from outside the body rather than within. The ear is one of the safest and most accessible gateways to the nervous system. It carries rich sensory pathways that speak directly to calming centers in the brain. It's familiar, it's non-threatening, and it responds well to gentle touch. To do this, sit comfortably and let your shoulders drop. Your face should feel soft, not alert. Bring one hand up to your ear and use the pad of your index finger, not the nail. Find the tragus, the small flap at the front of the ear. Rest your finger there and apply very light pressure for about 5 seconds. Then begin making small, slow circles, as if you were gently warming the area. Continue for about 10 seconds while breathing calmly through your nose. There should be no pulling and no stretching. After that, let your finger move slightly into the concha, the small bowl just outside the ear canal. Apply the same light pressure and gentle circles. Switch sides and repeat. If anything feels tender, ease up. If you feel lightheaded, stop and do this seated only. This should never hurt. It should feel soothing and reassuring. This gentle contact gives the nervous system a clear signal of safety from the outside. When the body receives that signal, vessel tension begins to ease. Circulation steadies. Over time, fewer stress surges support healthier flow, which helps reduce conditions that increase stroke risk. The third practice brings everything together, and it's built around something your body already trusts: breath. Breathing isn't just about oxygen, it's a timing signal. It tells the brain whether it's safe to stay calm or whether it needs to stay alert. Many people breathe all day without ever truly slowing the breath. That's why tension lingers. Sit comfortably with your back supported. Rest one hand on your lower belly so you can feel the breath move. Breathe in slowly through your nose for a count of 3, keeping the breath low and easy. Then gently purse your lips and let the air flow out quietly for a count of 5. There's no need to make a sound, just let the exhale be longer. Repeat this pattern for about 5 rounds, which usually takes around a minute. If at any point you feel uncomfortable, shorten the counts or return to normal breathing. There is no right or wrong here. The goal is a steady rhythm the nervous system recognizes. When the exhale stays longer than the inhale, the body begins to release vessel tension. Heart rhythm steadies. The system stops bracing. When you combine all 3 practices, something meaningful happens. The tongue anchors calm inside the body. The ear provides reassurance from the outside. The breath links them with rhythm. Together, they send a clear and consistent message of safety. For most seniors, doing this once or twice a day is enough. Morning and evening work well. Even a single round during moments of tension can gently bring the system back into balance. Before we close, there's one thing I hope stays with you. Calm isn't something you have to chase or earn. It's something you can return to quietly every day with patience and kindness towards yourself. Small, gentle care adds up over time, and often it's enough.